And tonight, Local 2 investigates a mental health care system that leaves thousands of people without critical treatment.
And we've discovered that this isn't only caused by a lack of funding. KPRC Local 2 investigative reporter Robert Arnold explains why state law also locks many of those suffering from mental illness out of the system.
You've got major issues ahead for our community.
This warning from the head of the Mental Health Mental Retardation Authority echoes throughout Harris County's mental health care community.
I think that we're just waiting. It's just a time bomb waiting to go off.
How did we get to this point? The short answer is money.
Here's in some order.
The 78th state legislature was facing a massive deficit, so cuts had to be made. One of those cuts involved what types of mental illnesses the state will treat on an ongoing outpatient basis.
What we've sort of done in this state is take a Band-Aid approach.
Texas provides money to only treat 3 types of mental illnesses on an ongoing outpatient basis: bipolar disorder, schizophrenia, and major depression with psychotic features.
And limiting access to individuals who, in particular those that I work with that are homeless, to 3 diagnoses, you leave out an entire population.
That's because the Diagnostic and Statistical Manual of Mental Disorders lays out roughly 300 diagnosable mental illnesses.
We all have to understand, we will spend the money.
Deputy Chief of Psychiatry for Bentop Hospital, Dr. Britta Ostermeyer, says that's because limiting funds for ongoing long-term mental health care creates a surge of people continually going into crisis. As we've showed you, a lack of funding has led to a staggering lack of bed space in Harris County, which in turn causes those with mental illness to clog ERs, jails, courts, and is feeding the chronically homeless population.
That prevent them from accessing housing, jobs, having normal relationships, etc.
Even if you are someone who can qualify for long-term outpatient treatment, the process can seem daunting. A lot of people don't have cars or the bus fare to make it to eligibility centers. Plus, for somebody who's mentally ill, filling out the volumes of required paperwork can seem impossible. And if you don't have an ID, like a lot of homeless people, then you can't get service, unless, of course, you go into crisis.
I told him, I said, I need some help, man. I said, I'm hearing voices.
Michael Moon lost his job and tried to get help for his mental illness, but says he had trouble navigating the paperwork. He wound up homeless for more than 2 years.
Oh, man, you had to sleep with both eyes open. They'd steal your shoes if you let them off.
It wasn't until the Houston Search Organization found Moon, got him an apartment, and helped him sign up for outpatient treatment that he finally got his life back on track.
I've got a beautiful apartment. I got somebody that I can go in there, and he says, well, how are you feeling today? I go once a month.
But even qualifying for outpatient services isn't a guarantee of instant help.
For those who don't have insurance, they have to wait weeks, months, or they don't get any appointment at all.
When you look at the numbers, you understand why the wait is so long. The Harris County Hospital District already receives an average of 1.2 million visits a year at its community-based health centers. Harris County Psychiatric Center has 17,000 inpatient and outpatient visits a year. MHMRA of Harris County sees close to 10,000 adults and children every month. And MHMRA has to take those coming out of jail or a psychiatric hospital first. So if an individual is not from one of these areas, they go on a waiting list.
If you're hallucinating today, it's not going to help to get services a month or 2 later.
The economic impact of mental illness on the state and local governments is about $1.5 billion a year. But if you factor in lost productivity because of mental illness, that number climbs to about $16 billion. Robert Arnold, KPRC Local 2.
Now, the Texas Department of State Health Services expects that 47% more adults and 195% more children are going to need mental health crisis intervention by next year. Now, if you've got a story for Local 2 Investigates, give the tip line a call at 713-223-TIPS or shoot them an email at local2investigates@click2houston.com.